Let's have now the second component, which is assessment. Under the assessment, we have A, assessment purposes, B, methods of assessment, and C, assessment principles. Assessment is the process of collecting information about a child's strengths and needs. It uses a problem-solving process that involves a systematic collection as well as interpretation of data gathered, according to Salvia and her co-researchers in 2013. In this component or in this stage, the teachers and administrators make instructional decisions based on the result of the assessment. This will be done after a child with additional needs undergone the pre-referral process. So that's pre-referral process and then assessment. Let's have now letter A, assessment purposes. There are a variety of purposes in special and inclusive education, but to be specific in here, we give assessment to children who have additional needs to identify which areas they are prone to have difficulties. So the result of this particular assessment used to decide on a child's educational placement and to plan instructional programs for a child who are identified to have these needs. It's another context when we talk about the progress, monitoring, and evaluation of teaching programs and services. Its purpose is to determine how effective programs are to assist inclusive teacher and the special education teacher, according to Gialani and Pierangelo in 2012. Now, there are a variety of assessment methods that regular and special education teachers can use, and these are the following. Number 1, interviews. Number 2, observations. 3, checklists or rating scales. And number 4, tests. Let's proceed now to letter B, methods of assessment. Methods of assessment are actually ways or types of assessment that will be going to use in assessing the child. Number 1, we have tests. School psychologists, educational diagnostician, and other related professionals use a variety of assessment tools to ensure that results are valid and reliable. So in here, there are two ways again to assess the identified children with have additional needs. And number 1 is norm reference tests. Norm reference tests are standardized assessment that compare a child's performance with a representative sample of students of the same chronological age. Such tests are rigorously made by a team. Results are reported as percentile ranks and age and grade equivalent scores, which makes it easier for professionals to determine class and individual performance. While such quantitative reporting makes it easier to compare the test performance of children in a class, it has its limitations in terms of use in instructional planning. Examples of norm reference tests are: number 1, intelligence test. For example, Wheeler Intelligence Scale of Students and Stanford Binet Intelligence Scale. Number 2, we have achievement tests. For example, Wide Range Achievement Test and Kaufman Test of Educational Achievement. Number 2 is criterion reference tests. Criterion reference tests compare a child's performance based on established standards and competencies and can be used to describe student performance. And that is according to Jennings and co-researchers in 2006, as cited in Spedley in 2012. In this type of test, scores are typically reported as simple numerical scores. percentage of correct responses, letter grades, or graphic score reports. Such assessment data are more useful and relevant as these provide specific skills a child has mastered and those that need additional instruction, according to Gargiulo 2012. Next, the test is informal assessment. So professionals also use informal or non-standardized kind of assessment, which are also considered more authentic and thus can be used primarily to describe performance and inform instruction. Such assessments can be curriculum-based or performance-based, such as the teacher-made instrument used in classroom and portfolio assessment. An example of this is the use of reading inventories, where a teacher listens to a child read while counting for accuracy and speed. Next, that is authentic assessment. Authentic assessments provide students the opportunity to apply knowledge and skills in meaningful, real-world settings. For example, classroom, playground, etc., rather than in an artificial and contrived setting, according to Dennis and co-researchers in 2013. The use of tests, whether formal or informal, is only one method of assessment. There are other ways of assessing students considered at risk for developmental delays or have additional needs. So one that is highly recommended by professionals is the use of the authentic assessment methods and tools. An example of authentic assessment is observation of, for example, young students as they interact with family members, peers, in objects in naturally occurring activities across the setting, for example, at home, school, playground, etc., and routines. So during observation, teachers and specialists can use running records which focuses on the occurrence of behaviors as they happen sequentially. Other examples are play-based assessment and portfolio assessment. Clay in 2000, as cited in Dennis and co-researchers in 2013, identified essential information to be included in a running record. And these are the following. Number 1, the date and time of the observation. Number 2, names of children involved. Number 3, location of the incident. 4, verbatim recording of what the children said. And lastly, number 5, actual events that occurred. Next to methods of assessment is the assessment principles. Assessment principles are actually guidelines to be followed in making assessment practices. So, assessment practices should be anchored on principles as provided by the Division of Early Childhood on the Council of Exceptional Students, or DEC, 2014. Child and family-centered practices, a team-based approach, application of individualized and appropriate process, and use of genuine and meaningful communication that adhere to ethical and legal practices are the recommendations provided by the DEC. We have to take note that a variety of assessment methods and tools, use of authentic measures, and as well as involvement of family are necessary to make decisions for placement and instructional planning, and that is according to DEC in 2014. At this time, let's have now the component number 3, which is placement. After finding a child who have additional needs and who may be at risk for developmental disabilities, who also undergone pre-referral process and the assessment, we will now know in this stage what is the best placement for that particular child. Assessment results are used to decide a child's appropriate education placement within a continuum from the least to the most restrictive settings. During the evaluation, student performance is assessed and the team determines if there would be any changes in the educational placement within the continuum. Teams will be based this on their observations, assessment results, and other factors, with the goal to move toward the least restrictive learning environment. Sound decisions are made to allow for fluidity in the child's placement based on the child's strengths, abilities, and needs. This picture shows the educational placement option for a child with additional needs. A general education classroom is the least restrictive environment for a child with additional needs. And according to Gargiulo in 2012, access to the same learning experiences and opportunities is provided as to typically developing students. Thus, it is considered the most normalized or typical setting. Additional support in the form of accommodations or changes in expectation through curriculum modification may be provided, but still within the same classroom as peers within the year level. Another option for placement is to be in a general education class, but the child receives supplementary instruction and services such as speech, physical and occupational therapy, or counseling services during the school day. Options may be provided when such sessions are conducted either during school or as an after-school service. Students who may be part of a general education class are pulled out of their class to receive instruction from a specialist teacher in a resource room. In a such placement, it is assumed that the child will benefit more from either a small group or individualized instruction with a specialist teacher who will be able to more intensively target his learning needs. Other students need more intensive support that is not provided in a general education class. Teams may decide to recommend placement for a child in more restrictive setting, such as a self-contained special education class but still located in a general education school. In this learning environment, all students receive individualized and group instruction with peers with disabilities and additional needs from a special education teacher. Depending on the program goals, students may be given the opportunity to interact with typically developing peers through school community building activities. Moving up in the placement continuum, some students who need more intensive instruction and supports are educated in a special education class in a special education school. Teams of professionals, along with a special education teacher, work with students with disabilities and additional needs in a highly specialized setting. On the other end of the continuum is the most restrictive or isolated setting, such as a residential facility where students live and receive their educational support 24 hours a day. Finally, children with multiple disabilities, often of the severe kind, are provided with home or hospital-based programs to manage their medical condition and learn as much as they could. Inclusive education espouses that all students, to the maximum extent possible, is provided access to general education classroom with the provision of support to remove barriers to enable success. That ends our discussion in the first three components of special and inclusive education.